Hello, this is my informative speech on asthma. While doing my research in my Seeley 7th edition Anatomy and Physiology book, I was looking for what asthma affected mainly. Asthma is a disease that affects the upper respiratory system. Asthma can affect people of all ages, but it's most common in children by the age of 5. Adults in their 30s and adults over 65. The exact cause of asthma is not completely known, but believed to be partially inherited. Many other infections and chemical factors can play an important role in asthma. Asthma is a disease that affects the passages of the lungs. It's believed to be caused by chronic inflammation of these passages, making the breathing passages of a person with asthma highly sensitive to certain allergies and triggers. When the inflammation is triggered, the passageways contract even further, narrowing or constricting the airways. This narrowing makes it difficult for air to be exhaled from the lungs. The resistance to exhaling leads to symptoms of an asthma attack. Asthma is a condition you live with every day of your life. You can have an asthma attack anytime you're exposed to one of your triggers. Asthma cannot be cured, but it can be controlled and managed with certain medications and certain steroids. People have a better chance of keeping asthma under control if it's diagnosed early in life and they start the treatment right away. With proper treatment, people with asthma have fewer and less severe attacks. Some symptoms of asthma are chronic cough, especially at night, wheezing that occurs during exercise. Some people think they have recurring bronchitis, since respiratory infections usually affect the chest of a person predisposed with asthma. The purpose of the lungs is to bring oxygen into the body and get rid of carbon dioxide. Oxygen is a gas that is necessary for life, while carbon dioxide is a waste product of the body. I read on livestrong.com that asthma experts believe that about 90% of asthmatics, the life expectancy is the same as the person that doesn't suffer from asthma. The key to that is that your doctor recognizes you have asthma and starts treating you right away. As long as your asthma is treated correctly, you should have no long-term problems. Although asthmatics that don't take their medications as prescribed can develop lung scarring that can further complicate their airways and make asthma harder to control. Some medication I found on WebMD.com are the right medications for you depend on a number of things, including your age, symptoms, and your asthma triggers. What seems to work to keep your asthma under control? There are 2 different ways to keep asthma from changing your lifestyle, depending on how severe your symptoms are. The long-term control medications that reduce inflammation in the airways that lead to attacks, and quick relief inhalers that quickly open swollen airways that are limiting your breathing. In most cases, medications need to be taken every day. Some examples of these drugs include inhaled corticosteroids. These are the most commonly prescribed type of long-term asthma medication. Combination inhalers. These medications may increase the risk of having a severe asthma attack. Some quick relief medications include short-acting agnostis. These inhaled bronchodilators can rapidly ease symptoms during an asthma attack. Ipratropium. This inhaler might be prescribed for immediate relief of symptoms. It is most commonly used for emphysema and chronic bronchitis, and is sometimes useful in treating asthma. Long-term effects of treatment drugs for asthma can cause serious heart-related adverse effects. They are atrial fibrillation, cardiac dysrhythmia, electrocardiogram abnormality, and tachycardia. Most say that while a 2-week course of steroids is safe, it is important to avoid long-term use. Some other side effects are weight gain, fluid retention, high blood pressure, and elevated blood sugar. Doing the speech is extremely vital for me since I suffer from asthma and I now know more about what's going on in my own body. Thank you.